Hey gang, it's Dr. Jarrod Frank here, and welcome to my first Instagram TV video blog. So I figured I'd start out with my first video blog being on my favorite topic, which is fat removal. And this is a topic that I'm very regularly talking about in my practice, and it's also a field of cosmetic dermatology that is overwhelmingly booming in the last 5 to 10 years. So, my area, my disclosure, my area of expertise has always been in fat removal, but particularly tumescent or laser liposuction, which fortunately for me, and contrary to popular demand, liposuction is not the Discovery Channel difficult, traumatizing, death-defying procedure that some people have the perception of. Traditional liposuction, which is usually done under general anesthesia, is a much more aggressive procedure, and it has very much gone out of vogue. Tumescent or laser liposuction is now the standard of care, and most people have to realize that fat removal with any technique is really for areas that are resistant to diet and exercise, not people that are resistant to diet and exercise. But the big wave, the big fad in the last few years has been in totally non-invasive technologies that somehow heat or freeze or destroy the fat from the inside, allowing the body to just metabolize it and pee it out. Obviously, there are going to be pros and cons to totally non-invasive, to more minimally invasive techniques. And really there is no best treatment, but there are some differences people need to know, because I would say about a third of my patients that do come in for tumescent liposuction have already spent a lot of money on non-invasive things, and we're just not told that maybe they were not the best candidate for procedures like CoolSculpting or sculpture. Now, these are procedures I regularly perform in my practice. I do non-invasive as well as invasive in my practice, but that doesn't mean that each treatment is for everybody. So what I tell my patients is, if you're looking for teacups, non-invasive may be an option for you. If you're looking for soup bowls or a gallon, then you're really looking for slightly more invasive means. Now, getting tumescent liposuction does not mean you have to put your life at risk. It's performed under local anesthesia. It's performed in our accredited surgical facility here. You are sedated, you're kept comfortable with a little Demerol and Valium, so there's no reason why you should be in pain. But you're able to go home on your own. There's no nursing care. There's no drains. There's no stitches. It's a very simple in-office procedure that's performed on the right patient who's healthy and has, needs to look like they've lost 10 to 15 pounds, fit into their old clothes or to fit in the clothes that God never gave them the proportions to fit into. So tumescent liposuction is still the gold standard. It's the procedure that is predictable. It has a quick recovery of 24 to 48 hours. You do have to avoid exercise for a week, but I could say in about 20 years of doing this and about 5,000 procedures, I've never seen a patient that lost a drop of blood. I've never seen someone go into the emergency room. And really the overwhelming majority, 90+%, can go back to work in 36 to 48 hours. It really is a weekend procedure. Now, that does not mean we still don't perform procedures like sculpture or CoolSculpting or Vanquish. These are all non-invasive technologies for fat removal. And they do work. There is science behind it. But you got to imagine trying to get rid of garbage in your backyard. You can only burn so much garbage in your backyard before you actually have to cart it out. So the body can only self-destruct so much fat and remove it at a time. So, if you're looking to reduce fat layers in limited areas, teacup amounts, love handles around the belly button, non-invasive may be for you. But it's important you know your options. So first and foremost, make sure you're evaluated by a physician, preferably a board-certified cosmetic dermatologist or plastic surgeon. You want to make sure that the physician you're consulting with does all these techniques. If you only have a hammer, everything looks like a nail. So if you only offer CoolSculpting, you're only going to get sold CoolSculpting. So it's important you speak to someone who has experience in tumescent laser liposuction and in all the various non-invasive techniques. And even amongst the non-invasive techniques, there is no best. We perform CoolSculpting, we perform sculpture. There are a lot of different options out there depending on the area of your body, what your expectations are. And non-invasive is not recovery or risk-free. You can get bruising and swelling. You do have to limit exercise afterwards. There are many non-responders. It doesn't help tighten skin as much as laser liposuction can. So I wish there was a simple answer in terms of what is the best fat removal option. Certainly diet and exercise is the first step in terms of optimizing your body contour and shape. But for those areas that are resistant, well, that's where someone like me comes into play. And in my practice, we really try and find the right procedure for the right person. But still, after all these years, tumescent laser liposuction is the gold standard. And a good portion of my patients that may have had non-invasive in the past sometimes move on to this. So it's important you find the right procedure for you. And you have it done by someone who has the skill and the expertise to not only pick the right procedure, but to get you the right result. So if you need more information on any of these procedures, check us out at pfrankmd.com or continue to follow us on at Dr. Paul Jarrod Frank on Instagram and Facebook. See you later.